Scholl with the International Water Safety Foundation, and he's going to tell us about his business.
Thank you. So before that timer gets started, I just want to say thank you, Brittany and David, for all the help for getting this thing set up. Zach Miller from Hatch, many thanks for everything that you've done for me over the last couple of years. I had the pleasure to present at 1 Million Cups last year for my company Swim Nerd, which there's some Swim Nerd stickers up there. And less than a year later, we raised $63,000 on Kickstarter and now have a nice little business in the works. And kind of at the same time, I had also been part of this nonprofit, which we're going to be talking about today. So without further ado, we are here to talk about drowning. So let's just go straight at it. So 1.2 million people are drowning every single year, and half of them are children under 5. We wanted to give you a little bit of a benchmark. So I have a question for you. How many people die from car accidents every year?
32,000.
1.25 million. How many people die from malaria every year?
1.2.
438,000. So my point is, it's been under-recognized for years and years and years. The World Health Organization's numbers are different than the 1.2 million. Their numbers are only just 372,000. But there's a number of reasons why this number is so skewed. These numbers don't include data from 66 countries. So 66 of the countries that probably have the worst drowning rates aren't actually getting data in. Partly because of the actual nature of drowning. If you get malaria, you're not dying immediately and you have a chance to go to a hospital and be looked at. If you're drowning, you're alive 1 minute, you're dead the next, and they just bury you. And there's plenty of other reasons, including religious reasons and other things like that. These numbers don't include drownings due to floods. If you've known, floods are getting pretty bad. They're increasing. The UN has certainly talked about that. These numbers don't include drownings to boating accidents or water safety transport mishaps. So again, like any refugee that's drowning in the Mediterranean right now, technically doesn't count as a drowning figure. And this is classified throughout the entire globe. So to try to give you a rundown in the history, I'm going to try to talk as fast as I can because I'm already only have 5 minutes. So the Alliance for Safe Children, which was started by Pete Peterson, the first U.S. ambassador to Vietnam, POW in Hanoi Hilton for 6 years, created this to basically figure out, what's really going on in these low and middle income countries. And what he found after doing these massive surveys, started in 2001, was that the drowning figures were 4 to 5 times greater than what the World Health Organization had actually estimated. Drowning is not fully reported to the World Health Organization because essentially they're not going to the hospital. The data gets collected in the hospitals almost everywhere in the world and then gets sent to the World Health Organization. So obviously there's a disconnect at the local level. Here's a great example in our first feature project. They did a study in Cambodia. They found that less than 10% of all drownings were actually reported. And they also found that over 50% of all children deaths in Cambodia are now drowning. What's happened is the communicable diseases have been pumped with money for over a decade, and we've essentially driven them down almost to the point of eradication, which is essentially what Bill Gates is really trying to do. Him and Justin Thoreau, they just pumped in $13 billion more to fight HIV and malaria across the world. So just a little review, drowning is one of the most, if you look at the World Health Organization's top 10 leading causes of death in the world, including heart disease, drowning would be number 10. So Mike Linden, he's part of TASK. He's the one who did most of all the studies, and he's the one that wrote this UNICEF report that came out in 2012 that basically said, guys, we're not even paying attention and recognizing this at the highest levels. So as you can see, The United Nations State of the World's Children report for the last 30 years have never talked about drowning ever. Here are the UN Millennium Development Goals, started back in 2000. You think the UN talked about any drowning at all? No, they didn't. And if you see number 4, the goal was to reduce child mortality. The low and middle income countries failed to meet that goal because of, you guessed it, drowning. Here are the new goals set up by the UN. These are the Sustainable Development Goals that go from 2015 to 2030. There's 169 goals inside of these 17 topics. Guess how many times drowning is talked about? 0 times. So what TASC did after they did the research and realized the problem was so big that they teamed up with the Royal Life Saving Association out in Australia, not Association, Society, and the Center for Injury Prevention in Bangladesh, and they created a swim-safe curriculum, right, to teach kids in low and middle income countries how to swim. Water safety education, survival swim skills, things like that. They taught 28,000 kids how to swim. No one drowned. Now, essentially, what Mike Linden and all the folks that have been working so hard to get this information are saying is that it's time to act, and it really is that simple. So what do we plan to do about it? It's a great question. We've invented something called a treadathon. Treadathon is a lot like a swimathon, so if you're familiar with the swimathon, then you'll get it. Instead of swimming back and forth, you're just going to be treading water with your friends. But the biggest part about this whole thing is to get the kids involved and let them understand how many kids are drowning, and they need to know that swimming is a privilege. We also have an educational arm to this, an awareness program, so part of our money goes to our Tats for Tats program, where we essentially send temporary tattoos with water safety rules on them to any school system in the world that asks. Our first program is Swim Cambodia, which this is Conrad Foote right here on the laptop. He's the trustee. And essentially the problem is there's no money in drowning because there's no awareness, and that's what we're here to do. That's it. Sort of. So, did you get all that? Good. We'll see if we can get you out in the open here. Hi, everybody.
Morning.
Morning.
This is why I brought these. I know they stack up real well.
Wave, everybody.
All right, so we're obviously we're here to answer questions. I think I gave a little bit a good rundown of what's actually happening, but perhaps not as much as the actual plan. So please, by all means, anyone that's got questions, especially for Conrad, we're going to be funding massive projects. These projects are already created. Conrad, when did you start Swim Cambodia?
So we became an official NGO 2 years ago. Can you all hear me?
Slightly. So 2 years ago, Swim Cambodia was created.
That's right. So we're setting up to deliver survival swimming, water safety education, safe rescue, and CPR also to children, because children die from drowning the most in Cambodia, more than adults. So yeah, that's what we want to do. Like we set up 2 years ago, and we've got a little bit of funding together. We're going to deliver teacher training next month in Cambodia and raise up leaders to go out and train their own people. So we're looking for Cambodian leaders to do that. We're starting with one province at a time. Drowning is very significant. 6 children die from drowning every day.
Just in Cambodia, 6 children drown every day in Cambodia. And I think one of the interesting things Conrad is saying is that these are sustainable projects, right? We're not just sending people in here, which we could certainly do. This room is filled with some of the best swim coaches, literally in America. And we could certainly go in there and teach people how to swim and we could leave, but that's not actually doing anything. We need to be training the actual people there so that they can continue. So one of the most important things that Conrad and Swim Cambodia is doing is we're training the trainers. And I think it's hard to measure the real impact that you're having, other than saving lives, when you start talking about providing people with training and skill sets and things like that. We all know that one of the main reasons why Haiti still gets rice from us is because we've pushed all the rice farmers out of the country because they can't sell rice if we're giving it to them for free. When you think about malaria, the easiest way to destroy malaria is to, they pump $2.5 billion just from little charities into malaria, and they just buy nets. The nets, you sleep in these nets, right? Well, that net's not giving you a skill set. That net's not giving you confidence. That net's not giving you leadership skills, and so it's vast when you think about the entire spectrum of what swimming really does for you.
Way, we can teach them land-based creature rescue using ropes, sticks, and teach bystanders as well to get involved with CPR. So at the moment in Cambodia, when a child dies from drowning, they hang them up by their ankles and shake. And obviously that doesn't work, but that's what they've been doing for thousands of years in China and all over Asia. So we need to teach them more CPR and get believable people to do that. So they need to be Cambodian teachers to do that. So we're investing, we've got 6 teachers we're teaching next month. I'm flying over there on the 20th of November to start that, and we're rolling that out. In Cambodia, there's only 20 to 30 Cambodian swimming teachers in the whole of the country. There's a lot more international swimming teachers, but they will come and then they will leave, and that's the problem, is keeping it sustainable so that children can be safe to enjoy water and to swim without danger.
All right, so if you guys didn't catch the drift of that, 20 to 30, there's only 20 to 30 instructors in Cambodia that teach swimming, period, in the entire country. So this certainly is a massive problem, and it's CPR is one of the biggest things. If we had some time, we could go back and show you like the actual history, like back thousands of years. I mean, we've been on this planet for thousands of years. We've been drowning for thousands of years. We're going to continue to drown unless we actually do something. And what Conrad was saying is, what they do is that they grab the little child by the ankles and they pull them up and they shake them, thinking that the water is going to drain from their lungs and all of a sudden they're going to be alive again. And we've seen that in hieroglyphics from thousands of years ago, because they're still learning the same thing when it's 2016. I think it's difficult to understand if you haven't been to a third world country. It's not the luxurious place that living in America really is. So ultimately, yeah, his program's teaching 6 more Cambodian teachers this month. He's flying over there in a couple weeks. And I think one of the other things to mention is Conrad is very far in front, where he's created a massive proposal. He's talked to Mike Linden. He's done studies and surveys and written papers himself. He's working with the biggest and the best drowning prevention charities on earth, and we still get phone calls. I got a phone call yesterday from Uganda. Moses Kalanzi calls me every week asking and hoping that we can help him out. So it's literally dozens and dozens and dozens of countries. If we had $10 billion, we could put people to work. It's not the number. It's not the people. We have the people. We have a lot of really good people that want to do this. There's just no awareness, and therefore no money, and no one's doing anything from the highest level down, except for you.
So is that treadathon? When is that active?